Right, welcome. If you're watching this video, that means that you are soon to be a new patient at McCabe Chiropractic and Wellness Center. So let me introduce myself. My name is Dr. Zach McCabe. I am the founder and owner of McCabe Chiropractic and Wellness Center in Hudson, Wisconsin, and we collectively are excited to meet you. And we want to introduce you to our practice a little bit. So that's why I'm here today. We're going to just asking you to watch this short video so that you know a little bit more of what to expect when you join us in the practice. So I'm going to share my screen and we're going to get started. All right, let's get rolling here. Again, welcome to McCabe Chiropractic and Wellness Center. So let me get this, there we go. Slideshow started. Okay, well, we sure do look forward to meeting you. Again, my name is Dr. Zach McCabe, and along with my brother, Dr. Matt McCabe, and our associate, Dr. Brandon Mondor, we are looking forward to seeing you in the office soon, and all the staff for that matter is excited to meet you. I'm sure you've spoken to one of them already regarding scheduling, paperwork, or the like. So what you're going to find out soon enough is that we place priority on health at our office. Our primary goal is to help you achieve 100% optimum health, whatever that looks like to you. And we're hoping that you do too, because unfortunately, in our society, especially in America, there's a lot of us that don't. In fact, I just find this statistic harrowing. Of the 35 industrialized countries in the United States in 2020, the United States ranked 26th of those 35 of life expectancy, average life expectancy at birth. In my opinion, that's just unacceptable, but it is real. Where Japan tops the charts at an average life expectancy at birth of 85. In other words, that child can expect to live 85 years. In America, 77 is the life expectancy. And the question is going to be, or the question should be, why? Why do 25 other countries have a longer life expectancy than the richest, arguably the richest country in the world, who should have the best healthcare? Not only that, by far, the two top killers in our country, the ones that the diseases, if you will, the causes of death that drive that number down in America are number one and number two on this chart: heart disease, and cancer. By and far, the greatest causes of death. And research would say that those two, especially those two causes of death, are more dependent on lifestyle choices than any other disease top killer on the list. So why are we so unhealthy in America, and what can we do about it? To understand that, let's just take a moment and define health. Because what does it mean to you? Have you ever stopped to think about what is health? What does health mean to me? A concise definition from Webster's dictionary says health is a condition of being sound in body, mind, and spirit. Arguably the health authority in the world, the World Health Organization, says health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. Notice those two definitions. They're not just saying healthy is not being sick, or healthy is being able to run a marathon, or walk upstairs without being winded, or being thin. Health is a state of being, a condition of being, a state of complete physical and mental and social well-being. It's not just the absence of what we consider to be disease. In chiropractic, we say health is a state of ease, where the body senses and adapts to its environment in an appropriate way. So I want to drive this point home a little bit to you right now. So we're defining health, and sometimes it's helpful to understand the antagonist of an object or a point of reference to truly understand it. So if we're going to define health, let's define illness too. And to do that, let's play a little game. So try to answer before I reveal the answer. Never mind, I changed the slide. We're going to put it right up there. So what is darkness? Darkness is truly the absence of light. Light is an energy. Light is a photon, physically, if we're talking about physics, and it is a form of energy. And the absence of energy is when we experience darkness, and that energy is light energy. And just like light, darkness and light, coldness can only be defined when we see or we experience the absence of the energy that creates it. In this case, we're talking heat. Heat is the thing. Heat is what has energy. Heat is literally atoms vibrating. And coldness is the lack of that vibration. The slower atoms vibrate, the colder our experience is. But coldness is actually, just like darkness, is a non-thing. It is what we experience when the energy that's associated with it is absent. So in the presence of that energy, we see light. In the presence of that energy, we feel heat. And in the absence, we experience darkness or coldness. And so therefore, what is illness? And this is going to be the key right here. What is illness? It is truly the absence of health and life energy. Health is the existence of something, right? It's a state of being complete physically, mentally, and socially, as the World Health Organization says, or a state of being sound in mind and body, according to Webster's dictionary. And illness is simply the absence of whatever causes those things. And in chiropractic, we acknowledge that there is an energy there. That illness is, and this is right from Webster's dictionary, an unhealthy condition. Even Webster's dictionary cannot define illness without first using health as its reference point. Illness is an unhealthy condition of the mind or body. In chiropractic, from a standpoint of illness, disease, and death, we use a term called dis-ease. That's the inability of your body to adapt to your environment. Remember how we defined health as a state of ease, where you easily adapt to your environment? Dis-ease is the inability to adapt. And keep in mind, this is a spectrum. We are all on it at some point. And I think a key point here is to understand that when you're on that spectrum, and wherever you are on that spectrum, you can do one of two things. You can either focus on the avoidance of every illness, disease, and inevitably death, or you can turn your back to those, and you can turn towards whatever it is that causes health, wellness, and abundant life. And that is what our focus is, both at this office and in chiropractic. So if that's going to be our focus, intentionally moving towards health, moving towards ease and life, we better set a bit of a foundation here. So we as chiropractors believe that we are designed for life, and that inside of you is a constructive force, a life energy that is at work, that helps you adapt. It coordinates every activity in your body. It's responsible for your animation or movement, for healing and for growth. And we call this constructive force in your body your innate, inborn intelligence. Your innate or your inborn intelligence. And we acknowledge the fact that your innate intelligence uses your nervous system as its method of action. The function of your nervous system is to control and coordinate every cell, tissue, and organ in your body. We know that from Gray's Anatomy textbook. We know that just in general, in biology and anatomy and physiology. And we as chiropractors understand that that innate intelligence that's in every cell in your body uses the nervous system as its method of action. Your nervous system is responsible for the coordination of every cell, tissue, and organ in the body. And every cell, tissue, and organ in your body has within it an innate intelligence that helps it do its job, whatever its job is, whether it's a stomach cell or a muscle cell, whether it's a brain cell or a stem cell. All of them have intelligence, all of them have a job to do in your body, and all of them are coordinated through your nervous system. And this is where we as chiropractors come in, is that your nervous system is protected by bones. Your skull protects your brain, your spine protects your spinal cord and the nerves that leave your spinal cord. And if those bones are misaligned or injured, that interferes with the normal function of your nervous system. Then, therefore, it interferes with health, interferes with your body's ability to heal, feel, or function the way that it's supposed to. And it's going to move us left on that spectrum towards illness, disease, and death. And keep in mind that these nerves aren't just responsible for feeling what you feel, but they literally control everything in your body, every organ, every cell, every tissue, every muscle, your blood system, your cardiovascular system. Everything is controlled by your nervous system. So therefore, it's imperative, it's extremely important that your nervous system is free of any interference, that it does its job. And we as chiropractors are the only healthcare professionals trained to take care of this issue called vertebral subluxation. That is our primary focus. It is the main objective of chiropractic. Now you might be asking yourself, well, how do I get these subluxations? And that answer is stress. That stress can be physical, and in fact, quite frequently, there is a physical stress involved with the beginning of subluxation. But that stress can also be chemical or emotional. And that's because stress, according to our brains, stress is processed the same way, and therefore it's cumulative. So physical stresses and chemical stresses and emotional stresses can lead to a change in spinal function that we call, again, subluxation in chiropractic. And those subluxations can start at birth. That often is the first physical stress to the body, especially if that birth requires intervention, like vacuum extraction or C-section, a cord around the neck, for example, or just a challenging birth. And birth is challenging. Along with that, as kids are learning to walk, to crawl, to sit up, to play, they don't realize their boundaries, and injuries often happen as well. Add on top of that, sleeping positions, think car seat, and other stressors, and subluxation can often begin at birth. And therefore, that is why we as chiropractors, as you see in the upper left-hand corner, that's why we as chiropractors see a lot of children for chiropractic care, because, you know, as the saying goes, as the twig is bent, so grows the tree. It's a whole lot easier to straighten a bent trunk on a small tree, on a sapling, than it is on a 30-year-old oak tree. Would you agree? Yeah. So let's finally get to what you can expect in this office. On your first visit, you know, we're going to start with a consultation. We're going to review your health history. We're going to talk about your goals, your concerns, any fears you might have, and your hopes, what you hope to accomplish. And we're going to answer any questions you have. We're going to ask you some questions too, so we can get to the bottom of what it is you want to accomplish in our office. Our next step then is to do an exam. We use some technology in this office that helps us understand how your nervous system is working. We'll also do some motion exams, understanding how well your body moves. We're gonna rate, if you have pain, we're gonna rate your pain, or if you're struggling with organ function, we're gonna talk about that. We're gonna do the exams necessary to get to the bottom of the cause of your concerns. And then very often in our office, we're going to take x-rays. We put a lot of focus on normal curvatures in the spine, on posture, and alignment, because we know that structure dictates function. We want that structure to be as close to normal as possible. And if we need to rehabilitate that, we're going to rehabilitate that. And we want to keep you actively engaged in that process. So it takes time and effort to change curves and posture, and there's a lot of work to do at home in those cases. But we also see folks for, simple pain relief too. And so we're going to, again, explain the goals that are possible, help you reach your goals along the way. And then, at some point, that first or second visit, very often on the first visit, you're going to get your first adjustment. So what should you expect there? We use primarily a hands-on approach. So you're going to feel the bone move often. Often we get the question, is it painful? What am I going to feel? You're going to feel movement. It isn't necessarily painful. It shouldn't be painful. Could it be? Yes, it all depends on your levels of inflammation. However, we expect relief and results after the fact, and we'll set some goals there too. What else should you know? We're gonna when we send you out, that first visit is going to take us about an hour, and then we're going to send you home with some simple instructions. We want to know how well that adjustment to your spine, how you respond to it, and then we're going to ask you back to review your x-rays, your exams, discuss what we found and what we can do about it. And then we're going to make a plan with you for your benefit, for your goals. Regarding those plans, ultimately, you're going to have 2 or 3 options of care in our office. Some people, they just want short-term pain relief, and that's fine. We are here to help. Other people would prefer functional improvement, where they find that their spine is stronger and more stable. And others want it all. They want structural integrity. They want that curve corrected. They want things as close to normal as possible, because they understand, you understand that you only get one of these spines, and it's important to take care of it. I've heard this analogy before. I think it's good, comparing us to dentists. If you could see your spine every day like you see your teeth, you would take better care of it. Trust me, we would. And that's where, for example, x-ray really comes in handy. We get to see what's going on in there. The image here in the bottom right, this core score, that is a tool we use to help assess function. So that's where we get our functional improvement, our measurement of success. The curve correction, our measurement of success, is seeing the x-rays change, curve correction, and then pain relief, pain is our measurement of success there. Beyond the chiropractic care, we offer a few other things in our office that I think you should be aware of. We offer something called soft wave tissue regenerative therapy. Soft wave is for acute and chronic issues. We see a lot of extremity issues with soft wave, and what it is an ultra focused high-speed sound wave that generates both stem cell and blood vessel production and recruitment of stem cells into an area for tissue healing in tissue that is typically hard to heal, like tendons, ligaments. We see a lot of shoulders, knees, elbows, things like that, plantar fasciitis. I'm just reading off the screen as I see them. We're certainly going to recommend probably some nutritional changes for you to speed up healing and give you some foundational health through supplements. Now, we, as a general philosophy, we want everyone to get as many nutrients as possible through their food. But we all know that our food is compromised in especially in our country, things that come in boxes, ultra processed foods are just, they don't contain nutrition. They contain at best calories, at worst poison, toxins. And so it is at times necessary to supplement our diet in order to promote healing and maintenance. Then finally, we also, that our feet are the foundation of our bodies. It's important that our feet are balanced and that we have a good foundation. So we do arch supports and foundational balance through something called foot levelers. It's an orthotic company many chiropractors use. So we are not unique in that way, but we have all these offerings as well that we may also recommend to you for 100% healing. And then finally, you might be asking, well, how can I pay for my chiropractic care? And that answer is we have three options here as well. So we are in network with most insurance companies, so you can use your insurance while you're here. We have self-pay options, cash, check, credit card, and we also have something called our WellCare plans for those people that enter into a maintenance or wellness phase. We have plans exclusively for them that offer some savings and some benefits, like discounts off of our other products. And so as you work your way through care, regardless of which one of these you might find yourself in, ask questions, and we are happy to help in any way we can, give you the most value possible. Which brings me toward the end here. I just want to, one, quote Thomas Edison as he says, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame and diet and the cause and prevention of disease." And that is the chiropractic mantra. He was not a chiropractor. Chiropractic didn't exist then, but that sums up chiropractic right there. We are a healing profession that does not use drugs or surgery, but our interest is in helping you understand how to take care of your body, how to understand what the cause is, and how to prevent dis-ease. And so we blend these three items: chiropractic, which is paramount, which is what separates us from other healthcare providers, that neuromusculoskeletal integration and integrity, along with body fitness and nutrition. And it is at those intersections that we, one, strive for wholeness, 100% health in life. And along the way, we want to make sure that you are supported. Does your diet support your goals? Does your diet support your body? And is your body interfering with your ability to do the things that you want to do? And we're here to help you achieve those. And we hope you partner with us to make that a reality. So again, on behalf of the doctors, I'm so pleased that you are going to be joining us. I hope this video was worthwhile to you, educational and a little entertaining. But along those lines, we're going to wrap this up, and we'll see you in a couple of days, maybe tomorrow, maybe today, I don't know, in the office. Either way, looking forward to meeting you. Have a wonderful day. Talk soon.